Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look at the prognostic factors. Prognostic factors in case of ALL. ALL stands for the acute lymphoblastic leukemia. Now the good includes the age between 2 to 10 years and which have a low WBC in case of females, in case of hyperdiploidy, the trisomy of 4, 7, 10 and 17, the T1221, the early precursor B cell phenotype. Now what are the bad prognostic factors? This involves the age which is less than 2 years, the presentation in adolescence or adulthood, peripheral blood blast counts which are greater than the 1 lakh, and it is male is a very bad prognostic factor. Then hypodiploidy, then comes the pseudodiploidy of T922, so 922 or T814 or the 411. Next is the MLL gene mutation as well as the T cell phenotype. To learn and grow daily like this, please do subscribe.